Well, good evening, everyone. My name is Dr. Arthur Vaughn. I am the Health and Wellness Chairman for the 100 Black Men of North Metro Atlanta. I'd like to welcome you to our third in our Health and Wellness series. In January, we talked about prostate health. In February, we discussed heart health. And today, our Vice President, Mr. Wayne Ellison, is going to lead a conversation on COVID-19 vaccines, availability, and access. At this time, I'd like to turn the program over to Mr. Ellison. If you have any questions, please feel free to put them in the chat. I will monitor the chat as he's moderating, and we look forward to you all having a great and informative evening.
All right, thank you, Dr. Vaughn. Again, welcome to everybody to our Health and Wellness virtual conversation brought to you by the 100 Black Men of North Atlanta chapter. Again, I am the vice president of the chapter. So again, we thank you guys for taking the time out to join us to talk about this certainly a serious subject. Tonight, I want to start off by introducing our speakers. After I introduce our speakers, we will jump into some questions. The first speaker I would like to introduce is Dr. Audrey Arona. Dr. Arona.
Good evening, everyone, and thank you so much for allowing me to be here with you. I am the District Health Director for 3 counties in Georgia. That's Gwinnett, Newton, and Rockdale counties. And there are 18 districts in Georgia, and I have one of those districts, including those counties. Prior to this role, I was a practicing OBGYN, delivered babies in the Gwinnett County for 29 years. So in any event, I'm just thrilled to be here tonight and hope that we can answer a lot of your questions and then some.
Thank you, Dr. Arona. Next, I would ask Dr. Archie-Booker if you would introduce yourself.
Good afternoon, and thank you so much for allowing me to be here. As was stated, my name is Elaine Archie-Booker. I'm Associate Professor in the Department of Community Health and Preventive Medicine at Morehouse School of Medicine. I am also with the Grad Education in Public Health at Morehouse School of Medicine, where I house our Masters of Public Health program. And I am the Director of Community Engagement for the Masters of Public Health program. And it's my job to make sure that we educate the people about our services and about health issues, especially in the underserved community, both in urban and rural Georgia.
Thank you. Next, Dr. Jasmine Clark.
Good evening, everybody. Thank you again, Wayne, and thank you, Dr. Vaughn, for this invitation to speak tonight. My name is Dr. Jasmine Clark. I am a state representative for Georgia's House District 108, which is located in Gwinnett County and encompasses the city of Lilburn and the surrounding unincorporated areas of Lilburn, Norcross, Tucker, Stone Mountain, and Lawrenceville. Along with being a state representative, I am also a senior lecturer at the Emory University School of Nursing. I teach microbiology, anatomy, and physiology to undergraduate students, as well as pathophysiology to students pursuing advanced practice nursing. And so again, I appreciate the opportunity to be here tonight, and I look forward to a robust conversation.
Thank you. Last and certainly not least, Dr. Hines.
Hi, good evening, everyone. I'm Dr. Jeffrey Hines. I'm a gynecologic oncologist with Wellstar Health System, and I also proudly serve for Wellstar as their medical director of diversity, inclusion, and our Center for Health Equity. And really want to thank Dr. Vaughn and Mr. Ellison for having me be a part of this amazing panel this evening.
Thank you. Again, we're going to start off with a series of questions. To our guests, I would ask that if you have a question that you would put it in the chat, and we will certainly get to your questions after the series of initial opening questions that we have for our guest speakers. So the questions I'm going to ask in general to our speakers, and any of you guys feel free to jump in and answer the question, obviously from your line of work and your perspective. The first question is it important for us to wear double masks now?
I would start with that. Yes, it is. A lot of the masks are made to be very fashionable, but they don't protect. The COVID-19 is an airborne disease. and it is transmitted by the air. A lot of the masks do not have the filtering that needs to be done. Also now, what is different is we have a lot of different variants of COVID that are now here in the United States. So it is important that we double mask. One of the things that our current president is talking about is to send out N95s to everybody, okay, so that we can help reduce the possibility of getting corona, but to also make sure that you don't have to double mask.
Can I jump in on that? And say the KN95 masks are good because unlike other masks, which are really used to prevent transmission meaning you are giving the virus to other people, and it's really used to kind of block your respiratory droplets from spreading out and possibly contaminating others. The KN95 mask kind of works in both directions, and so it's a good mask because it is actually it has a better filter to block out the virus. That said, I do think that double masking right now is going to be good for just that added layer of protection. Early on in the pandemic, we did not have access to a lot of masks. And so we were basically wanting to make sure that we had the surgical mask and the N95 mask or KN95 mask. And to be clear, these masks really should be fitted in a certain way. So there's that part to it. And a lot of people, theirs don't fit them appropriately, but that's another thing. But early on, we wanted those medical masks to be for medical personnel because there was a bit of a shortage and there was a difficulty in getting access to those. And so we basically just said, make cloth masks and use cloth masks. Well, then there was a whole industry that boomed from that, but not all masks were created equal. And so honestly, it's probably better now to use a surgical mask as well as a cloth mask when you're double masking, or use two masks that are of two different types of material. It will help filter things better.
Thank you. Would anybody else like to chime in? Okay. What is the age the vaccine is currently approved for now?
Can jump in on that. Currently, we have 3 vaccines that are available to us, and that's the Pfizer, the Moderna, and then recently the Johnson & Johnson. Novavax is on the horizon, and I do think that we'll see an EUA from that one soon. And again, we can't comment on the age distribution of that one just yet because it hasn't been submitted yet in terms of their trials and all. But the other vaccines, the only one that's approved for under 18 is currently the Pfizer vaccine, and that's for 16 and up. We were actually hoping that the Johnson & Johnson would provide 12 and up because they did include children in their studies, but for some reason the EUA is only approved now for 18 and up. I do believe that we'll see a vaccine for children, or some of these vaccines will be open for children, hopefully in the near future, but it's going to take some time.
I'll comment on that as well too. Right now, as mentioned, there are the 3 vaccines, 2 for 18 above and 1 for 16 above. But I will say there are data that hopefully will be released very soon for 12 to 16, because those studies have been done. The data just hasn't matured. And interestingly, just in the past couple of days, Moderna announced that they were going to do some clinical trials in young children as young as 6 months old up to 11. So we'll have that spectrum of everyone covered, the youngest to all the way up to adult. So that data is forthcoming.
All right. And would anybody else like to jump in on that? All right. The next question, typically Blacks are vitamin D deficient. Maybe that's why Blacks are hit hard by the COVID-19. Should Blacks just load up on vitamin D instead of taking the vaccine?
I will jump in on that one and say, while it is important to have vitamin D for a plethora of reasons, vitamin D is necessary for the uptake of calcium so we can have strong bones. But vitamin D also plays an important role in, our ability to fight off infections in general, and, our immune system and things like that. So vitamin D is good for you, and you don't have to take supplements. Vitamin D is provided to you by the sun. So going outside and getting adequate amounts of sunlight is one way that we can increase our vitamin D, but you can also supplement as well. That said, vitamin D is not going to stop you from getting COVID-19. COVID-19 is a respiratory virus. If you inhale it and it gets into your lungs, it will be able to access the cells that it needs to access in order to cause infection and possibly disease and be transmitted to others. And so there is no guarantee, and I think there were studies actually done, there's no guarantee that vitamin D will stop you from contracting COVID-19, and it will not stop you from giving COVID-19 to others. And so this vaccine is still very important as a way of immunizing people against this virus and stopping the spread of this virus so we can get past this pandemic and slow transmission and contraction of the virus.
Thank you. Dr. Arona, with the crude case fatality rate of 1% in Gwinnett County from the COVID-19 implying a 99% recovery rate, why would we even bother to get the COVID-19 vaccine?
Yes, that's a great question. And what's really important to understand is the long-lasting effects of COVID on our body after infection. So we know that this virus is, very difficult and hard on our pulmonary system, our cardiovascular system, even our brain function, as many people have witnessed. And so while the crude case fatality rate is lower, the long-term effects of COVID can be significant on your health. And so therefore the vaccine can prevent that, obviously. There's really two things about the vaccine. One is how well does it protect you from getting COVID? But more importantly is if you get COVID, how well does it prevent severe disease, hospitalization, and death? And so all the vaccines that we have available right now are very effective at preventing the latter, and that is severe disease with hospitalization and death. And so there's a lot of talk about Johnson & Johnson not being as effective, but it actually is very effective, more effective than even the flu vaccine. But it's not as effective from keeping you from getting COVID as the mRNA vaccines do. Keep in mind that flu vaccines at the most are 40% effective from getting the flu, from keeping you from getting the flu, but they're very effective in terms of preventing hospitalization and death due to influenza. So again, the long-lasting effects of COVID are really significant on even young people. And so that's a reason to get the vaccine as opposed to just preventing death.
I'll chime in a little bit on that. That's just an amazing answer. And the only additional thing that I would add is that, yes, these are disease preventing vaccines. They prevent the potential risk of you getting infection, severe infection, hospitalization, and death. That's important. There is some data out now that's been reported in the past several weeks looking at several areas where now we finally may see some decrease in transmission of the virus. So not only is it going to be protective to you, and that's a reason to get it, it's also potentially protective as a citizen of society, as you may help transmit it. So that's another reason why we would all encourage people to strongly consider getting the vaccine.
Thank you. Thank you. If I were to get the vaccine, why do I still need to wear a mask and social distance?
So can I jump in on that? I think that Dr. Hines did a good job of leading us into the answer to that question. Right now, the studies are showing that there is number one, there is still a small chance that even if you don't get very, very sick or die from COVID, you can still get it even if you're vaccinated. In that small chance, there's also a small chance of asymptomatic transmission. However, studies are showing that even that may be extremely decreased, if you are vaccinated. And so until we learn more, it is better to be on the safe side and make sure that we are not inadvertently spreading the virus via asymptomatic spread, because now we're not sick and we're out here and we're trying to get back to our regular lives, but there are still others out there that, number one, are not vaccinated yet, because there are still people that are not vaccinated. And then number two, people who are still vulnerable, maybe they can't get vaccinated for whatever reason. We want to make sure that we're protecting them too. It's also important to note that vaccines are not instantaneous. There's some time, it takes time to build up that immunity. So if you get your shot on Monday, it's not time to just go out Monday night and, throw all caution to the wind. It takes actually a couple of weeks before the full effects of the vaccine are in place. And again, even still, there's a very, very tiny percentage of possibility of contracting COVID, although you won't get very sick or die. And there is still a possibility of transmitting COVID to others.
Mr. Ellison, I just want to make one other factual piece of information is, everyone is concerned about the strains and the variants these days. The reason why we develop strains and variants is because the virus is able to replicate. The virus replicates through transmission. So we can significantly cut down on replication of the virus and replication of new strains and variants from coming if we continue to mask and physically distance ourselves. So that's another reason why, even though you're vaccinated, it's still critically important to wear a mask.
Thank you. Next question, does the vaccine alter my DNA? I know some folks have had some thoughts around that. Dr. Clark?
The answer is no. It does not even come in contact with your DNA at all. The vaccine the Moderna and the Pfizer vaccines are both mRNA vaccines. mRNA is basically the molecule that our cells use in order to make proteins. The mRNA is located outside of your cell's nucleus. Think of the nucleus as the room in your cells where the DNA lives. The DNA is in the nucleus. The mRNA leaves the nucleus and goes into the rest of the cell in order to make the proteins. And so the mRNA vaccines do not need to and do not go into the nucleus. They stay in the rest of the cell where they go in and they make just the protein that we need for our immune system to recognize the virus, so that if we come in contact with the virus, we can fight off the virus. And I wish I had a whiteboard or something that would kind of draw this out, because I think it's really important for people to understand that cellular processes are not random and they're not just happening randomly. Cellular processes are very distinct. And the vaccine does nothing to your DNA. It doesn't even see it. It is completely separated from your DNA by the walls or the envelope of the nucleus.
All right.
Great. And I would just add also that, the actual vaccine itself with the mRNA that's manufactured in that fat droplet, and that's what allows it to get into our cells, actually dissolves. And so the remnant of the vaccine is no longer in your body at all, but the effect of it as to stimulating our body's production of antibodies against the COVID virus is what lasts.
Thank you. Do men end up becoming sterile as a result of the vaccine?
I can answer that. I have, daily we get updates about symptoms, side effects. I have yet to see any side effect of men being sterile from the vaccination. As we said, it is not something that alters that. It's not manufactured to do that. So I have, unless some of the other panelists, I have not seen anything that connects the virus vaccination to sterilization.
Anybody else want to jump in there? All right. Can you get a facial paralysis from the vaccine?
The only test case that I saw about, and maybe some other panelists, was early on. AstraZeneca they stopped theirs early on last year, and they had a case where they had some paralysis from one patient. But since that time, I have not seen any documentation of any facial paralysis associated. I checked today. I didn't see any updates about any facial paralysis. Most of the symptoms would be something similar to the flu type with chills, fever, soreness, body aches. Those are most of the symptoms or side effects that have been associated with the vaccinations.
I can add to that also. Early on, and you're right, because there aren't very many recent cases of that. I think there were 7 cases that reported after millions of doses before, but the important thing is to note that the frequency is not any more increased than the general frequency that occurs in the general population. And it is a self-limiting condition. For those of you who don't know what we're talking about, we're actually talking about Bell's palsy. And that's basically a nerve condition that causes partial or complete weakening on one side of the face. And it's hard to really pinpoint a cause, but viruses itself can trigger a Bell's palsy as well. And so again, the frequency at which we're seeing this, if we see any future cases at all in the future, is really not any greater than the general population frequency.
The next question. I've already had COVID-19, so I have the antibodies. Why do I need the vaccine?
I'll start on that one. That's an awesome question because so many of us now have been exposed and either know it or we're asymptomatic carriers. We need to have a conversation real briefly about natural immunity versus vaccine-induced immunity. And it's unclear how long natural immunity may last. When you look at studies in vaccines in general, it appears that vaccine-induced immunity in general causes a more robust and prolonged sense of immunity compared to getting the infection. Clearly with COVID-19, the more serious your infection, the longer your natural immunity will last. But there will be some time where that immunity is over. And that's why it is important for even patients who have been affected by COVID-19 should get a vaccine. Now, there are some caveats. Clearly, many people who get COVID-19 sometimes get convalescent plasma. You may have heard that one blood product that people get to help with COVID-19, or even as an outpatient, you may get the monoclonal antibody therapy. And if you got either of those 2 therapies, you need to wait 90 days before you get a coronavirus vaccine. But for the most part, otherwise, people say anywhere between 14 and 30 days after you have an infection, it would be important for you to consider getting a vaccine.
Dr. Vaughn, can you tell us some of the questions that we have in the chat?
Yes, certainly. We will start. Let me open it up. I was in a different place. So one of the questions, please explain the mechanism of action of the Johnson & Johnson vaccine. How does its MOA differ from the mRNA virus?
I can tackle that one. So the Johnson & Johnson vaccine is pretty much the vaccine technology that we normally use. In this case, the genes for the spike protein are delivered to our cells by a viral vector. In this case, it's an adenovirus vector that delivers the gene, and then our cells make that spike protein. And then again, once we make the spike protein, it tells our immune system, hey, this thing is a thing that we know doesn't belong in our body. And so it allows our body to mount a response against the spike protein if you come in contact with the actual virus. And so the way I like to explain vaccines generally is if you think about the way our immune system works already. The way our immune system works is when you first encounter something, some foreign agent that doesn't belong in your body responds to it, but it takes it a while. It doesn't know. It's a foreign invader that it does not know how to respond to necessarily. And so it builds up a response to that. But once you go through that primary infection, our immune system creates memory. So the next time your body sees that same infectious foreign invader, that same infectious agent, it does not take it as long to respond to and knock it down because it has seen it before. Vaccines help us to get around that primary infection by basically creating an artificial primary infection. We allow our bodies to go ahead and see the bad thing without actually having to get sick. We see the bad thing, which is the spike protein that is on the outside of the virus, and our bodies go ahead, mount a response against that bad thing, create the antibodies and the memory to it, so that if we come in contact with the actual virus, we are able to fight it off very quickly, so quickly that a lot of people may not even know that they came in contact with it. They may not even ever feel any type of sickness at all. The Johnson & Johnson, again, uses older, I won't say older, but the technology that we use for a lot of other vaccines with the adenovirus vector, and that's different than the Pfizer and Moderna, which is a newer technology, but it still uses the same concepts of presenting that spike protein to our immune system so we can fight it off if the real virus comes to us. It's just a different method of doing it. And it's something that we've been trying in a lot of different areas. This idea of using mRNA is not novel. It's something that we've been studying for over a decade, and studying in not just SARS-CoV, but in other areas, cancer and other diseases as well.
Thank you.
Outstanding. We're going to move to the next question. And this is not me necessarily, but I have rheumatoid arthritis, and I've been told that there are factors in the vaccine that can aggravate autoimmune illnesses. I'm honestly scared reading stories of people having severe reactions and dying after the second shot. Have there been studies or trials done on people who have autoimmune diseases and the vaccines? Can I make one statement about that before one of you incredibly intelligent scientists say something? So I have an autoimmune issue because I'm a transplant recipient, right? I got a heart transplant 18 months ago. And initially, the thinking with my physicians at Emory were those of us who take immunosuppressants every day to do exactly that, suppress our immune systems. They initially said they didn't know if the vaccine was going to be helpful for us. Well, their thinking has changed. And the logic on it has changed. And in fact, they're recommending us with transplants to get the vaccine. And we intentionally suppress our immune systems every day. So my sense is that And one of the scientists, like I told Dr. Clark earlier, I'm a social scientist, so it's a wee bit different. My sense is, based on my own experience, is that these vaccines, I haven't had any ill effects other than a slightly sore arm for a couple hours, but I haven't had any other effects, and I've gotten the Pfizer vaccine.
Dr. Vaughn, thank you for that comment, and you're absolutely right. First of all, immunocompromised patients are more at risk of severe consequences of the COVID virus. And so the vaccine is particularly recommended for folks like you and others that have conditions that weaken our immune system. So again, the whole point of it is for protection of this virus that can have horrendous long-term, even short-term, but basically long-term complications in our body systems. So you're absolutely right about that. That's from, I know some of you others are more scientific than I am, but.
No, not more scientific, but I will just affirm what the two of you just said. I'm a cancer doctor as well, too, and I give patients chemotherapy every day. And our national organizations are affirming just what Dr. Arona said, is when, and the data, the literature, in God we trust, everyone else must bring data. It's important, it's critically important to prevent patients who are immunocompromised to get coronavirus. So it is absolutely indicated. And what we recommend to people and what our national organizations are recommending is to talk to your specialist or your primary doctor about the timing of when you should get it, because there may be something about timing, but absolutely not contraindicated. Please get it if you're immune compromised for any reason.
And the only thing I would like to add to that is that we need to make sure that when you take it, that you're monitored. Usually we wait, tell everybody to wait 15 minutes. You might need to wait a little longer, or make sure your doctor is involved when you take that, because you already had the autoimmune problem, it might be a little longer, and you might need to be observed much more closely.
Thank you.
And I know this question has been thoroughly answered, and I agree with every one of my fellow panelists on this. I do want to point out one thing, though, in that being immunocompromised is not necessarily the same thing as autoimmunity. Those are two different mechanisms. Autoimmunity is basically your immune system being hyperactive. Immunocompromised is your immune system being hypoactive or not active enough. That said, the CDC does say that it is okay for people with with autoimmune disease to get the COVID-19 vaccine. People with autoimmune disease were included in the clinical trials. There's no specific data that on people with autoimmunity currently, but there is also no specific data that says that it is contraindicated in any way. And so I do think it is very important for you to consult your doctor if you have concerns. But I also think it's very important that I think it's very important that we are mindful of where we get our information. And there is a lot of misinformation that floats around, and it gets around very, very, very quickly. And so I think trusting the medical professionals who know you and who deal with you, who deal with your medications and things like that, that's probably the best place to go if you are unsure or feeling slightly insecure about the safety of the COVID-19 vaccine.
Standing.
Dr. Vaughn, our next question.
Sure. What is the difference between efficacy and effectiveness? I've read that the Johnson & Johnson vaccine is not as effective as Moderna or Pfizer.
I'll start. Thank you for that question. That's so important. In my mind, effectiveness and efficacy are equivalent. Some people may argue with that, but it's just how much do you prevent whatever endpoint you're measuring, whether that's infection, hospitalization, severe side effects, death. So the Moderna, the Pfizer, and the Johnson & Johnson product are all effective and have good efficacy. Now, a lot of us are focusing on those percent differences, and let's just unpack that just a little bit. We have to understand Pfizer and Moderna, those clinical trials were done in an earlier time period during the pandemic and done in a time frame when there weren't a lot of variants. When you look at the Johnson & Johnson vaccine, it was done a little later on in the pandemic, and it was done in countries like the UK and South Africa and Brazil, where there are a lot of variants. So you may look at the overall effectiveness as being less. But I think it was Dr. Clark who said earlier on, you got to look at what we're really trying to prevent. And I think we need to switch that narrative. We need to message to people and talk to people. All three of these vaccines prevent death. And that is critical for us to message to people. And if you want to quiver about a few percentage points, you can, but just understand when those vaccines were trialed and where they were trialed. The efficacy of preventing severe infection and death is very equivalent among those three products.
Thank you. Thank you, Dr. Hines. Just quickly, I don't want to take credit. So it was actually Dr. Arona that kind of brought that up. And I want to reiterate something that she said earlier. When we talk about how effective the vaccines are, or the efficacy of the vaccines, which in my mind are also can be used synonymously, you know, some may argue against that, but I do believe they can be used synonymously. I think it's good to remember what is the objective? So if the objective is preventing contraction, preventing you from getting COVID-19, then the effectiveness of each of the vaccines is slightly different. The Pfizer and the Moderna is higher than Johnson & Johnson. That's probably what you all are seeing when y'all are seeing these percentages. But when it comes to the question of if I get COVID, if I get it, will I get sick enough to go to the hospital, or will I die from COVID? Then all three of these vaccines are equally as effective in that all three prevent getting so sick you need to be hospitalized, or you losing your life to COVID vaccine. And so that matters. From a public health standpoint, when we're talking about preventing transmission and spread and mutation of the virus and new strains, yes, I have personal opinions about each of the vaccines, but I think no matter what, if we are keeping people alive and we are keeping people out of the hospital, that should be the end game. And if that is where your focus is, then all three of these vaccines have been shown to be extremely effective and equally as effective at doing that.
All right. So I want to direct this next question towards Dr. Archie-Booker, not that others can't answer it. Are these vaccines only available at those mass vaccination sites, or can I get the vaccine at my doctor's office?
Yes, a lot of your doctor's offices have them, and a lot of the hospital systems. If you are patients of Emory, if your doctor works with Emory, Piedmont, Northside, Wellstar, a lot of those physicians, you can go there and they have it. We are now have it at our pharmacies, Walgreens, CVS, a lot of those have it. Publix, they have it. You can also, we gave them at Morehouse School of Medicine. So it's a lot of different sites. So no, you don't have to go to those massive sites where they have it. You do have a lot of them. They are trying to get a lot of more community-based. There are some counties that have mobile units that they're trying to mobilize and take to areas, and which I think is a great, I'm working with someone in DeKalb County about getting that set up. Morehouse is getting their mobile units, trying to get that set up. So we're trying to take it to the people that actually need it. And they also are venturing, they're trying to get the homebound people, trying to get them vaccinated. So there's some programs coming around where you don't have to go. So you can check, and a lot of the doctor's offices are carrying it. But I know if you are a member of your physicians, or especially with the big, larger hospitals, they are giving it there.
And yes, thank you, Dr. Booker. That's perfect. But I wanted to add a couple things, and that is that, you know, the problem with vaccine distribution has not been one of scheduling. It's been one of supply. As soon as our state can receive adequate amount of supply, it's going to be available everywhere. Pharmacies, doctors, large chain pharmacies, public health, universities, hospital system, urgent cares, all of that. For an example, our state alone has over 2,100, almost 2,200 providers that currently are enrolled as providers, and only half of them are receiving vaccine right now. And that's because there's a shortage of supply. But I love your comment about those, the access, because, you know, a lot of people can't access a computer and all that. And so we've been working with senior centers, we've been working with community centers to get our elderly. And now that, you know, the teachers, we're working with schools. And also we're working like you are with your mobile teams to get out to churches and other community centers to not only spread the word, but try to get more uptake in the vaccine, and then also to bring it to areas of our county where it's difficult for us to administer it right now. And for those people to come to us, we need to go to them. So it's a all hands on deck as soon as we can get all the vaccine in. You know, people have a comfortability factor with, would they rather go to their doctor to get it? Would they have a relationship with their pharmacist? Maybe they'd like to go there. Or, you know, they've been to the health department before, and so they feel more comfortable. So again, whatever, I would just like to have this vaccine out to everyone, available at the places where they feel most comfortable. And I do believe that as time goes, hopefully, and we've been promised that our allocation of vaccine is going to increase hugely in the next few weeks. And so we're looking forward to that.
Okay, great. Thank you. Our next question is, if you received the Pfizer or Moderna vaccine already, will you need an additional shot to combat the newer strains of COVID that have originated in other countries that have made it stateside? Excuse me. I hope you understood that. I got a little tongue-tied at the end.
I understood your question. So far, the research says no. So far, the research is showing that these vaccines are still effective against the newer strains. And so that is a good thing. But as far as long term, will we have to get boosters, you know, in a few years or not? That the jury is still out on that. The research is still being done on that. I am hoping that the answer to that is no. I'm hoping that we see that the antibodies last long enough that it's not something that requires a booster, but it is possible. But as far as, you know, if you think about it from the standpoint of like how we have to get a new flu vaccine every year, it is my hope that we do not have to deal with that with SARS-CoV, but we just don't know yet.
I'll just add to that. The people who were enrolled in the clinical trials are followed for a minimum of 2 years, and they're getting testing done regularly, and particularly looking at what their antibody status is. And so Dr. Clark is absolutely correct. We will get that information. It just isn't available yet, but we will know what the effectiveness of vaccine-induced immunity and how long it lasts will be.
Okay. So someone asks, some believe the JJ strain is live and can be contagious. Is there any truth to that theory? And can we start by explaining what the JJ strain is and then answering the question on a larger scale? Because I've not heard of the JJ strain.
I think the question is about the Johnson & Johnson vaccine. I'm pretty sure that's what they're referring to.
Okay.
So the Johnson & Johnson vaccine is, I will have to check this, but I do not believe that it is live virus. It's a vector, so it's not live virus. So it's not contagious. You know, it's just like many other vaccines that we've taken over our life from the time we were littles all the way to, you know, being young at heart. You know, this is, it's not any different than many of those vaccines that we've already taken. And so the answer to that is no, it is not going to be contagious. It's the opposite. It's going to stop you from being contagious, I believe.
Outstanding.
Yeah, that's awesome. The Johnson & Johnson vaccine, as mentioned, uses the adenovirus as its vector. They manipulate the adenovirus so it just gets in your cell, but it doesn't cause you to get infected with adenovirus, which is a common infection. But it's a DNA vaccine, so it has DNA in it. It does not have any viral particles or any virus in it at all, nor does Moderna, nor does, and that's an important myth to bust. And I hope among these panelists tonight, we can bust a bunch of myths. It is not true. None of those 3 vaccines that are available right now under emergency use contain the virus at all.
Outstanding.
And I would like to add also that the new virus that we're looking at, or the new vaccine called Novavax that's coming out, that one is also not a live virus. That's completely a different vaccine entirely. It has no DNA or genetic information or material in it at all. Basically, it's a lab-made subunit protein that's made that is delivered into your cell to do the same thing as the others are. But I just wanted to make that point just to make sure that it will be relevant to the Novavax as well.
Yeah, the Novavax vaccine is just like the human papillomavirus vaccine. It's that protein subunit. So it contains no genetic material. It's just protein.
All right, cool. So how long after I've tested positive for the virus is it acceptable to get the vaccine?
Well, I can go with that one. First of all, there is no time requirement. What we do want to make sure is that you're not acutely ill from COVID when you get the vaccine, or acutely ill from any virus or bacterial infection or anything. We want people that are healthy to get the vaccine. As Dr. Hines was saying earlier, there's a natural immunity once you've been positive. And so we know that that'll wane after about 90 days. And so, but you don't have to wait the whole 90 days to receive the vaccine. We just don't want you ill at the time you get it.
Okay.
Again, the only thing that I would mention is that if you happen to have received convalescent plasma as part of your treatment, or if you received the monoclonal antibody therapy as part of your treatment, and many people have, then you really should wait the 90 days before you get a coronavirus vaccine.
All right. Can you all explain the lingering effects of contracting coronavirus? And how long can we expect the symptoms to last?
Man, I think for some people get coronavirus and they don't get so much as a sniffle. And then some people get neurological symptoms, such as losing their sense of taste or their sense of smell. And yes, that is neurological. Those are things that is your nervous system. Some people get, extreme or severe pneumonia, which is that filling of fluid in the lungs. All of those things, like there's, in my opinion, as I've watched this virus progress, I haven't really figured out a rhyme or reason of who gets what. It's all a gamble. And so because of that, what we have also found is that some people get the virus, they get sick, they get better, and then they don't experience any other symptoms. And then there are others that have these lingering effects that even months after having coronavirus, they are still feeling the effects. Also, some of the lung damage that happens when you're actively sick is lingering as well. We are also seeing, we've also seen evidence of clots, embolism, stroke, things like that, also a result of COVID-19. And so this goes back to the point that we made earlier, and I just think it's a good place to put this in. Death is not the only thing, death is not the only reason we want to stop people from getting COVID-19. Despite how many people survive, there are people that are surviving, but they are still symptomatic, or they are still feeling the long-term effects of these viruses. And from an economic standpoint, when it comes to healthcare, we don't, these might lead to things like pre-existing conditions or future health issues down the road. And so all of that needs to be taken in consideration as to why it is so important for us to take this virus seriously and to get vaccinated and to, make sure that we're taking all the proper care and precautions to prevent the spread of this virus, to stop ourselves from getting it and also to stop others from getting it, because you just don't know. It's a gamble, and you don't know where you're going to fall on the spectrum. And you don't know where the person who you might give the virus to, if you just throw all caution to the wind, where they're going to fall on the spectrum. And so it's important collectively that we keep in mind that it's not just about death. I say all that to say the symptoms can last as short as, a few days to months. And there are people that contracted the virus last year that are still complaining of symptoms right now in 2021.
Okay, I'm going to turn over. Wayne has a question he's going to ask everybody, but we're at 10 minutes to 8. And this is a very important topic, and people are really engaged and are sending questions. Panelists, do you mind giving us just a couple of extra moments past 8 to answer some additional questions for this very critical topic for the community? All right, thank you. Wayne, go ahead.
Thank you, Dr. Vaughn. To our panelists, it appears that the virus has mainly affected minorities. And however, minorities are probably taking the vaccine. I think, Dr. Arona, you had made mention that the rate that minorities had taken the vaccine was at less than 10%. Is that correct? So it appears that there's a lot of fear and angst, if you will, amongst African Americans, from taking the vaccine. So to the panelists, how would you address, those concerns and fears?
Well, I'll go ahead and start with that, Wayne, and you're absolutely right. We are seeing a little bit better than 10% of our people being vaccinated now that are African American. But this is really a problem because African American and Latino populations are more affected by this virus than others. And so this vaccine is so important for that group, especially because of the worsening effects of COVID. My whole thing is that, I believe that it's really important to address myths and concerns that people have. And I would love for those in attendance to really ask about some of those because, and I think some of what the questions are tonight do address some of those things. But I also applaud you for having this kind of conference tonight because, African American voices need to be amplified. You all are incredible leaders in our community, and listen to you, and the credibility that your voices give to our community is incredible. And so I really applaud you all for being here tonight. And it's the local change makers like yourself that really matter here in terms of addressing issues, gaining confidence. I'm happy to see that African Americans, at least the percentage is increasing, but it's not increased enough. And again, we're trying to address the access and trying to get to the people who need this vaccine if they can't get to us. But I really need your help because my reach is only so far. And so, and we do have to address the myths and everything that's associated with this vaccine, and that will decrease vaccine hesitancy and increase vaccine uptake and get it to the people who really need it the most.
All right. Thank you. The people we thought were Zoom bombing us, I have removed from here. Sorry about that, everybody.
I just want to jump in really quick and say that was some quick action. So I applaud you on handling that very swiftly. That was good.
Thank you. So I have a question about myths.
Hold on, Dr. Vaughn. Did you, let's make sure the other ones jump in, before I want to see whether or not Dr. Clark or Dr. Hines have anything they want to add to that, or Dr. Booker.
Dr. Hines, go ahead.
Ladies first. Go ahead, ma'am.
I was just going to add, yes, there is some fear, and yes, there is some angst. And the forums like this and getting the word out to our community is one of the best ways to dispel myths and make sure that people are getting accurate information about the vaccine. But I also want to point out something that we talked about a little bit earlier, and that some of the lower numbers of our Black American or Black Georgians not getting the vaccine might not be because they don't want it, but because they don't have access to it. And so as Dr. Arona alluded to earlier, we're going to have to think outside the box to make sure that we're getting the vaccine to people who actually want it, and not assuming that because they're not getting it, it's because they don't want to get it, but that there might be an access issue. So I just want to point that out, that it's not all fear and angst. Some of those numbers are reflective of us needing to really be innovative in the way we distribute the vaccine to people who want it.
So may I ask really quick, and Dr. Hines, this will go to hopefully your answer. Okay. When we have a history with Dr. James Sims, the father of gynecology, so-called, right? The Tuskegee experiment, or the issues that Henrietta Lacks and her family went through, and African Americans by and large saying, "Yeah, is this vaccine an attempt at genocide?" Another question came out about impotency in men. So how do we address the community that says, "Hey, this is just another experiment on Black folks to do social norming or population control"? How do we address those things that some people say, and in a lot of, and in some mind, I'm not going to say a lot because I haven't quantified it, are real things?
That's a really important question. And I think, as was said by both Dr. Arona and Dr. Clark, we need to find the trusted messages from trusted messengers. And perhaps the 4 or 5 of us as panelists tonight can be that trusted message and a trusted messenger. You have to acknowledge that Henrietta Lacks, Tuskegee, J. Marion Sims, forced sterilization on imprisoned women. You have to acknowledge that that happened. You got to meet people where they are and acknowledge it. You have to educate people about the importance and some of the disproportionality that certain communities have suffered with the infection and hospitalization and deaths, and now with decreased uptake. And then we got to convince people why it's important. So you've got to acknowledge, you've got to listen, and you've got to educate. And getting people who are trusted to you, maybe it's your physician, maybe it's your clergy member. The one thing I will add, then I will be quiet, is we're finding more and more from national data that more and more Black and brown people want to take the vaccine. So clearly, like Dr. Arona and Dr. Clark said, the issue of access is critical, and we need to address access as it is. Many people can't take time off from work to go stand in a line for 4 or 5 hours to get a vaccine. Many people, if the vaccination site is not on a public transportation line, are not going to be able to get the vaccine. Many people don't have some young cat at their house that can get on 2 and 3 devices to get an appointment made. So we have to address all of those issues as we get shots in the arms to people where they need it, how they need it, and when they need it. That is the definition of equity: where, how, and why.
So
I just want to add real quick to that. I would just go on with everything they say, but we have to take the message to wherever we need to. We're going to be doing a workshop virtually, of course, at a daycare center, because the staff called and asked us will we come do it. Excuse me. And it's over on Donna Hollowell, which is in the heart of a place that we really want to get to and spread our message. I also want to say if we can have, I can in the next hour could probably get 800 people of color to sign up if we didn't have the digital divide. and all these other issues that we come in contact with. Because as Dr. Clark said, and as the other panelists say, it's a lot of people of color. If you look at the numbers when it first came out, a lot of people didn't. Now that they see that a lot of family members of those, they trying to get it, but the accessibility is limited.
I have a quick question. We talked about the different kinds of different kinds of vaccines. So if you have allergies or anything like that, or earlier you said, if you can get one of the three, get one of the three. But if I have allergies or severe allergies, does that make a difference in which one I might lean towards?
I'll start with that one. Often that comes out of the issue of egg and egg allergies. None of the three vaccines that are available under emergency use authorization right now are made in eggs. So people that have egg allergies or other allergies, you can safely take these three vaccines. What is recommended is if people have had what we call an anaphylactic reaction to other vaccines, that you probably talk to your doctor ahead of time. And like Dr. Archie-Booker said earlier, you're going to be one of the people who should sit after you get your vaccine for 30 minutes or more, not just the 15 minutes. But these are not made in eggs at all. So people that have food allergies, egg allergies can safely take it. You can go to the CDC website and see exactly the components that are in these vaccines.
This will be my last question, Wayne, and then I'll turn it back over to you to close us out. But is it nasal rinses or gargling with hydrogen peroxide effective at killing the virus?
The virus is going to be in your lungs, and nasal rinses and gargling are not going to get to your lungs. And if they do, then you're definitely not doing it right. So to answer that question, no, it is not going to be able to stop a virus that is in your lungs from, causing disease. I love a good nasal rinse during, if I ever catch a cold, which I haven't caught one in a long time, but, oftentimes those are used as more like to clean this, clear the sinuses, but they're not necessarily preventing disease. So unfortunately, no, that's not going to be effective for a virus that affects your respiratory system and generally attacks the lungs.
All right. As we close out, Dr. Vaughn, if you can just briefly take everybody off of mute, I'd like to give our panelists a round of applause and thank them for their time. Well, so if everybody would just briefly,
it'd be quicker if they take themselves off of mute for me to figure it out.
If everybody can just take yourself off of mute real quick. Again, I want to tell our panelists, thank you.
So one thing I want to say about this panel, we have Gwinnett, Rockdale, Newton County Board of Public Health, Cobb Douglas Board of Public Health, Emory, Wellstar, all represented here. So we wanted to give you a very broad cross-section of experts that represent our service area, and hopefully you got some valuable information that you can share with others tonight. You'll all get an email because next week we're going to be doing our next in this series, and it's going to be on mental health and dispelling the misconceptions. But you'll all get an email inviting you to that as well. Wayne?
All right. Again, I want to thank everybody for taking their time out to participate, in our health and wellness virtual conversation tonight. Again, to the panelists, I certainly thank you guys for taking your time out and making a difference, in our community. Everybody be blessed, stay masked up, wash your hands, keep your distance, hey, be blessed. Take care. Thanks again.